Good morning. Today's Tuesday, January 7th, 2025, and of course, I'm going to start 2025 with a blooper. So welcome to Titus Regional Medical Center's 2025 Community Updates. We're so excited to share the year, and a lot of things been going on at TRMC over the last few weeks in the holiday season, and you got to admit that cold in the air this week is just exciting. And I love it, and to my friends and coworkers here who just hate it, and that's why they live in Texas, it's been fun to have that cold air. So excited to start this year with you. We truly appreciate the community support of our health system, and we appreciate the opportunity to provide you health care on a daily basis. And we look forward to just sharing things with you this year, and I love using this forum to get our message out there and just to talk to our community members. I want to finish up last year with an All Is Bright. It was a wonderful night, and I appreciate everybody who came out for the event, and Pastor Davis, Dr. Hooks and his daughter, Dr. Rundles. And it was just so many people who came out that night to, one, celebrate the year and celebrate people we've lost the year and raise a little money, but it was more about celebrating and remembering, and what an unbelievable night. And we have a video that'll be coming out in the next couple days of that night, and I can't wait for you to see it. I shed a tear when I watched it. It was emotional, and truly appreciate everything that we've had. And we start 2025, and we have our baby new year, and truly appreciate the opportunity to share this with this young couple and this young lady and the little baby there from that one, and all the gifts that were given by TRMC team members, and JD did a nice sign for the baby and everything. So it was a lot of fun to celebrate the 2025 Titus New Year baby, and it was an exciting time around the health system. We're starting, the reason why we did Tuesday and the reason why we did 10:30 is tomorrow's Lunch and Learn. And with the first being on a Wednesday, that second's going to come here quick. And the second Wednesday of every month, except for July and August, we have our Lunch and Learn. Our community, 55 and years older, it's $5 for a meal. You can't beat that. But we start tomorrow, January 8th, 11:30. Start people coming in and seeing stuff. We really kick off eating about 12 to 1. We have a presentation. Tomorrow's exciting. We're going to have 5 of our new docs come. They'll be a part of the community. They will be in the community. They will be on the floor. They'll be sitting with you at some tables. But join us at 11:30. But it's exciting. I love our Lunch and Learns. And it's exciting to see 200 plus people every month just to talk about what's going on, and this time of year just to celebrate. If it's your birthday in January, you'll get a prize as well. It's New Year's resolutions, and we're all different. Wellness Center is packed, and it always is this time of year. But the Pounds Down Challenge is coming soon. The team over at Titus Fit has done a great job the last couple of years. It's been amazing to watch the people participate in this Pounds Down and the impact it's had on their life. I really like to watch the impact and what's going on. So watch out for that over Facebook over the next few days and what that's coming up. But the Pounds Down Challenge at the Wellness Center, things are going great over there. They've got a lot of new equipment they're getting in just to help with the volume. So we're excited about it and appreciative of the team, the trainers over there. If you need some individualized trainers, there's some great team members over there who can build a plan for 2025 for you. One of the opportunities that I've had as part of this health system is to participate with the American Hospital Association and also participate with the Texas Hospital Association and Torch and participate in some podcasts. I enjoy a lot of those different things, and please follow me on my Twitter at TRMC CEO Terry. We'll be putting out a podcast on health equity that came out a few weeks ago. I was given the opportunity by the American Hospital Association to talk about, what did we do during COVID? What are we doing from a community standpoint? Health equity is so many different things to so many people, but it's really important to rural communities and making sure that you're taking care of the segments and taking care of the individualized needs. So that podcast will be coming out. I appreciate the opportunity that was given to participate in that, and we'll be putting that out on Twitter the next few weeks. So watch for that on my Twitter. If you don't follow me, get a Twitter account at TRMC CEO Terry. You, me, and my mother will be on my Twitter account. So we're excited about that. But we're excited. Never too early to start planning for February, and it will be right after our next community update, but I want to put your calendars to save the date, as everybody talks about. February 8th is my favorite thing to say in the world. React quicker, save your ticker, Heart Health Fair. It's Saturday morning, February 8th from 8 o'clock to 11. I promise you, it's going to rain. It's going to be cold. It's going to be windy. It always is. So when we have this health fair, but it's a great one. Our cardiovascular team does some great stuff with this. So put that on your calendar. Labs are very expensive that day. We do the labs. And for many people in our community, it's the only time they do their labs during the year. So we got a lot of activities and resources that day. So February 8th, join us in the TRMC Mall lobby. It's a great time. And remember, react quicker, save your ticker, health fair. Just love it from saying it from there. You know, I talked last month about the new physicians that are coming, and I just want to reiterate those as well. We are excited about having 5, 6, 7, now 8 or 9 physicians join us from the Texarkana area and move into our community. Dr. Scott Black joined the Heart and Vascular Institute at Titus, interventional cardiologist. I have to give him a thumbs up. He did a cath on Mom over the last few weeks when Mom was in the hospital, and he was amazing. It was fun to watch him, Dr. Siegel, Dr. Sekulich, Dr. Babas all work together, but Dr. Black did that heart cath on Mom, so I was able to watch him firsthand and just watch him explain the process to my mother and go through that. So I have to give him a thumbs up, and I gave him a 5 on the survey, a 5, not a 4, a 5 on the survey. But Dr. Black did a great job, and for the ones who are coming from the Texarkana area that are patients of his, I understand why. So we're excited to add him. He will be at Lunch and Learn. Yesterday, Dr. Peterson started our surgery associates at Titus office on the second floor. A lot of renovation on the second floor in the last few weeks to get ready for these new physicians coming in. But Dr. Peterson was here yesterday. She will also be our trauma medical director, and she'll be very involved with the breast cancer and the breast service line. So we're excited about that as well. But she started yesterday, and she's been around the hallways this morning, so it's been good to see her. And also Dr. Marnie Sorensen, general surgeon. We're excited to have him join us and on the second floor as well. So 4 physicians with Dr. Sorensen, Dr. Kincaid, Dr. Beauvais, and Dr. Peterson on the second floor. So 365 days of call at Titus. There's very few rural hospitals in the state of Texas who can say that, and we're excited that we can provide that service. We also, with Dr. Sorensen and Dr. Peterson joining us in the last few weeks, we've also purchased an XI. We'll have a press release in the next few days about that. Dr. Kincaid did a robotic procedure on that XI a few weeks ago, right before the end of the year. I saw her in the hallway, and she was just bubbling that she's, Terry, I just did a procedure on the new robot. And this was a robot if we would have had when I was going through my cancer treatments, I could have had my surgeries here. But since we didn't have the XI, I had to go to another health system with the XI. We now have those needs here, and I'm excited to share those with the community, and we'll be putting out a press release about that. So Dr. Peterson and Dr. Sorensen, general surgeons, will be there tomorrow as well. And then Dr. Malik, neurologist from Wadley as well, has joined us and starts seeing patients today. For all of our patients of the Neurology Center at Titus with Dr. Khan and Dr. Malik, we did some renovations in the last 2 weeks. We appreciate our friends at Stansel Construction and the work that they did for us. It's gorgeous. So the patients of Dr. Khan, we have torn out walls and created hallways and created offices and the flow. We still have a door to put in, so everybody who has patients with a wheelchair, we're working on that. And hopefully in the next few weeks we'll get that door replaced with a nice electronic door for you on the second floor. But the Neurology Center at Titus has 2 neurologists, and there's very few rural hospitals in the state of Texas that can say that. There's very metro hospitals that can say that as well. But we have 2 of the best, and I'm excited to see what comes out of that. We had a patient over the weekend that came from the Ida Bell area because they knew of the stroke care that we have here at Titus, and the wife thought her husband was having a stroke and brought him here for those symptoms. But Dr. Malik and Dr. Khan, I'm excited to see what they are, and when you come see them the next time, you get to see them in their new space. It's pretty cool. I was blown away and appreciate everybody involved in that process. And then the other change you'll see at the hospital, and she'll be here tomorrow at the Lunch and Learn, is Dr. Haroon. Our hospitalists and our interventionists and our ED docs really trying to have more local docs. And Dr. Haroon and her team are going to be local docs in the future, and we're excited to have her here. So saw that in the last few weeks, our ED docs, so trying to get more local, a more cohesive medical staff, and we're excited about that. But Dr. Haroon will be at Lunch and Learn tomorrow, and you'll get to meet her and hear a lot about her journey and what she finds at the center. And a few of you got to have her as a patient, and she actually admitted Mom from the emergency department. I got to watch her admit Mom, and the whole process was just amazing. So again, excited about our new docs coming. I was excited about the stories over the holidays, the goods, a few bads, but goods as well. More goods. And we do have our coffee chat. I want to remind you, I've enjoyed having this. Tiffany, Tracy, myself, and several others join us at the Coffee Chat with Titus. We're the first and third Wednesdays of each month, so we'll be there not tomorrow, but next week. But it's a good opportunity, and we have an email as well. Check us online for the email. But if you have any questions about Titus, or any stories, or any patient experience you want to share with us, or things you would like, or questions. I got one of our patients the other day when I was at a physician office says, what about this chatter? What about this? Had a great opportunity to talk to him about it. So please join us for coffee, 9 to 10, the first and third Wednesday. Drop me an email as well, and be glad to respond to you. And if that 9 to 10 doesn't work, I can meet for coffee anytime. I love coffee, especially as I get older from that one. And I want to finish today with just Happy New Year. And I appreciate the slide Bobby D did. It's amazing. And, I always love the start of a new year. We had a great 2024, and a lot of things were just wonderful in 24. I'm so excited about 25. I hope you can see it, hope you can hear it, hope you can feel it from me, that there's so many wonderful things that we have planned for 2025. The team that we have at Titus, the doctors, the medical providers, the medical staff, the nurses, the clinical people. There's a lot of great things going. We have a lot of things we're going to announce in the next few weeks. We're going to do a capital campaign that we'll be working with our board with in the next few weeks to announce as well. So exciting changes, and every one of those changes will be to improve healthcare and improve the wellness of the community of Northeast Texas, Mount Pleasant, and Titus County. On behalf of the team at Titus, Happy New Year. Thank you for your support. God bless. And thank you.